Good evening. You are tuning into AWANI Tonight with me, Farhana Sheikh. Malaysians face another subdued festive season. How do we care for our mental health and keep spirits up? And are generational loans the answer to home ownership? That's coming up. The Health Ministry forecasts that Malaysia may hit 8,000 new COVID cases a day by first week of June, should poor compliance of SOPs by the public continue. Previously, it had forecasted around 5,000 new cases a day by June if SOPs are not followed. Health Director General Tan Sri Dr. Nur Hisham Abdullah in a tweet said the country's average infectivity rate, or R0, is currently at 1.14. Perak has the highest R0 at 1.32. The ministry calculated that the R0 could go up to 1.2 if SOPs are not followed. However, strict compliance with SOPs could bring the R0 down to 0.8, pushing new daily cases to below 1,000 by the first week of June. Malaysians once again celebrate a muted Hari Raya as the country faces another lockdown. With celebrations constrained, we speak to consultant psychiatrist Dr. Amir Sidek on keeping our spirits up, despite the challenging situation where many of us are forced to celebrate Raya far from our loved ones.
Well, it's really important for us to continue celebrating these celebrations. It's part and parcel of life. We really do know that COVID is probably going to be with us for quite some time. So I think the first or the most important thing for us is just to make sure that we have certain things in place. Make sure that, if you want to celebrate, first of all, at home, if you've got your family and loved ones, do the celebrations as normal. It's just that you don't have the visitations. Second is actually if you're alone or somewhere away from home, then, with technology at this point of time, you can actually still have celebrations either through Zoom calls or FaceTime or whatever visual kind of calls that you can actually have. And I think that the third one is actually to take a break during the celebrations as well.
Dr. Amir weighs in on how to better take care of our mental health as we face many uncertainties arising from the pandemic and the MCO. He said one of the ways to keeping anxiety at bay is by sticking to a healthy routine.
It's really important that we have a routine, because one of the reasons why we're feeling anxious and probably depressed, if not overwhelmed with the situation, is because of the uncertainty that happens as a result of this on and off movement control orders, and also having a routine actually obliterates or removes that particular uncertainty. So that's the first thing. The second one is actually to make sure that we have adequate rest. Sleep is really important. Often during this period of time, we tend to slack a little bit. Make sure that your sleep is regular. Thirdly, as well, as we've seen, one of the good things about the SOP this time around is that they're allowing us to do lots of physical exercise. Exercise really improves mental health. It's probably one of the evidence-based non-medication things that you can do for yourself. So that's really important. And I think the fourth thing for us is actually to make sure that you do a lot of self-care. Now, self-care is something that you actually enjoy doing, that's there particularly to improve on your health, be it physical, social, or mental. Make sure you have some of those activities.
Dr. Amir also underscored the importance of relaxation technique to beat anxiety.
It's really important for us to have at least a relaxation technique or time. And the most easiest one is going to be breathing exercises. There could be other relaxation techniques that other people out there might be doing. Meditation's another one. So having these 5 things in place and doing it regularly, irrespective of the situation, actually improves your mental health greatly during this period of time. So I think finally, I just wanted to also wish all of you here Selamat Hari Raya and Maha Zaitin. And again, there's no health without mental health.
When discussing about home affordability issues among the lower income group, we revisit the proposal made by the Better Malaysia Foundation, a government-backed 100% financing to B40 house buyers through 2-generation housing loans. What is the trade-off for such scheme? And will it address housing unaffordability in Malaysia? We speak to Dr. Carmelo Ferlito, CEO of the Centre for Market Education, on the matter.
We do know that home ownership rate in Malaysia is pretty high, close to 78%. So when we discuss in general affordability and home ownership, we have to keep in mind that the home ownership rate is already pretty high among the generality of the country. Well, if we look at the affordability in a very traditional way, so just by measuring the relationship between income and the average price of houses, we can say that there are plenty of houses in the market that are not in the range that is affordable for the B40. However, I believe that we should look at this matter from a wider perspective, which includes also accessibility to social mobility opportunities. So to simply look at income and price is quite limiting, you know. So I believe that rather than home ownership, in this moment, the priority to be looked from a policy perspective is the household over GDP, the household debt over GDP, which is 93%. So it means that the rakyat is in a position of financial weakness or financial instability.
Carmelo thinks that BMS proposal in exposing B40s to multi-generational housing loans will put further financial stress on the group.
The possibility to give 100% financing and over a period of 60 years, we are looking precisely at the fundamentals that created the big economic crisis in the West around 15 years ago. So we don't want to avoid that. We have to be sure that if we push for home ownership, we are not also pushing for financial instability. And in this moment, financial stability is more important as a policy target than home ownership per se.
Carmelo believes in a rent support scheme that would lower the financial burden of the group.
I believe that the best way is to imagine rent support schemes that allow the B40 to have a roof, to have a house, not necessarily to own a house, but to be in a place where they have access to social mobility. So rather than being poor with a house, they are poor that aim not to be poor anymore, and therefore they can save enough money and decide eventually to buy a house if they want. Because let's not forget that owning a house is a choice, is not necessarily a right.
We'll take a short break. Stay with us. Welcome back. The Israeli military has intensified its assault on Gaza as Hamas continue to fire rockets into Israel on the fifth day of hostilities. Israel's army said air and ground forces were involved in attacks today but had not entered Gaza. Visuals show Israel has massed thousands of troops along the Gaza border. Israel's army said it destroyed many kilometers of underground tunnels in Gaza, which they say Hamas used to move and launch attacks on Israel. If troops actually crossed into Gaza, it would be the first time since the 2014 war that Israeli troops have entered Gaza to fight. The Israeli strikes have killed more than 119 people in Gaza, including 31 children, according to Palestinian officials. The UN Security Council is expected to discuss the worsening violence between Israel and Hamas on Sunday. In the conflict between Israel and Palestine, both sides have taken to airstrikes and rocket attacks. Israeli Prime Minister Benjamin Netanyahu said its Iron Dome missile defense system had intercepted 90% of the 1,200 rockets that had been fired from Gaza. Just how does the Iron Dome works in intercepting rockets? Videos on social media showed that the rockets were hitting an invisible shield. When an interceptor sensor detects an incoming rocket, it detonates its own rocket, sending out fragments. If the timing is right, the fragment will hit the rocket's warhead, detonating it. Gaza, an occupied territory, meanwhile, is far less capable of defending against attacks from Israel. Satellite images shows the destruction on Gaza. Israel has sent more than 600 airstrikes into Gaza since the conflict reignited this week. The number of COVID-19 infections in India climbed above 24 million today. India recorded 4,000 deaths and over 343,000 infections in the last 24 hours. Crematoriums around the country are overburdened by the number of deaths from COVID-19. Countries are alarmed as the highly transmissible Indian variant was spreading fast across the globe. The World Health Organization said the variant has been detected in more than 44 countries. Singapore announced one of the strictest curbs on social gatherings and public activities since easing a lockdown last year. The city-state is facing a rise in locally acquired COVID-19 infections in recent weeks. The new measures announced include limiting social gatherings to 2 people. Dining in at restaurants will be banned. The restrictions will be effective from Sunday to mid-June. Authorities said they will review the measures after 2 weeks to assess if adjustments are needed. A travel bubble between Hong Kong and Singapore set to open on May 26 has a high chance of being postponed again. The bubble between 2 of Asia's main financial hubs had been slated to begin in November, but was suspended after a spike in cases in Hong Kong. This time, it is Singapore that is seeing an increase in cases. Singapore Transport Minister Ong Yew Kang said a decision on the matter will be made by early next week. Fully vaccinated people in the United States will not need to wear masks outdoors and can avoid wearing them indoors in most places. Centers for Disease Control and Prevention also said fully vaccinated people will not need to physically distance in most places. The agency hopes the updated guidance will encourage more Americans to get vaccinated.
The CDC is saying they have concluded that fully vaccinated people are at a very, very low risk of getting COVID-19. Therefore, if you've been fully vaccinated, you no longer need to wear a mask.
The new guidance still calls for wearing masks in crowded indoor settings like buses, planes and hospitals, but it will help clear the way for reopening workplaces, schools and other venues. As the third wave of the COVID-19 infections rage on in many parts of the world, one country is gearing up to reopen its borders to tourists. Greece is hoping to be a safe destination for travellers this year as it tries to revive its key tourism sector battered by the pandemic last year. On the Aegean island of Naxos, locals are busy dusting off tables and chairs ahead of Greece's official launch of the tourist season on Friday. The summer will be vital for Greece's chances of bringing its economy out of the COVID crisis following an 8% fall in GDP last year. The tourism sector employs 1 in 5 workers. Tourists from countries in the European Union as well as others including Britain and the United States will be allowed to visit as long as they have been vaccinated or can show negative COVID-19 test results. Greece has vowed to finish vaccinating its entire population over the next 6 weeks. Vaccinations reached record daily levels this week. Roughly 1 in 10 residents have been fully vaccinated. Is the true spirit of Malaysia the one that's fostered between neighbours across fences? On Consider This, Sharat Kutan and Melissa Idris asked panellists how to stem the slide into an increasingly divided nation to instill trust but also accept differences. That is all we have for you on AWANI Tonight. Get the latest news update on COVID-19 and COVID-19 vaccines from astroawani.com and Astro Awani app. I'm Farhana Sheikh on behalf of the AWANI Tonight team wishing all of you Selamat Hari Raya, Maaf Zahir dan Batin.